Ami was asleep in the nurse's arms. She didn't notice the noise around her. She was calm and didn't know that 1 hour before, the nurse was still struggling to get her to breathe. Ami was asleep. She didn't know that only that same morning she was traveling in her mother's womb in a canoe to get to the hospital. Ami didn't know that her mother was only 18 years old and exhausted from giving birth to Ami's twin brother in a village 24 hours earlier. Ami didn't know that when she and her mother finally arrived at the hospital, there was no midwife, and that she was lucky to even be alive. Since her country, Sierra Leone, had one of the highest infant mortality rates in the world. Ami was asleep. She didn't know that behind a door, the only doctor at that hospital was giving her mother a blood transfusion. She didn't know that her mum had lost too much blood to survive. Ami didn't know that she and her brother would grow up with a feeling of missing something essential, which the other children had. Today, Ami is 25. Since that morning when she was lying in her nurse's arms, the maternal mortality rate in the world has nearly halved. But still, there are 830 women dying every day from pregnancy or childbirth. 99% of them in developing countries. Still, women travel to hospitals by canoe. Still, there is a lack of doctors and midwives. Nearly all maternal deaths could be prevented if women had access to essential maternity and healthcare services. Ami has just given birth to a girl. Both she and her daughter are alive. Ami knows they're lucky. Did you know?